Welcome to Made Non-Toxic. In this episode, we're going to discuss about the duodenal anatomy. So, duodenum is a C-shaped organ which is 25.5 centimeter long, containing Brunner's gland. It is covered by peritoneum for 2.5 centimeters. Following that, it becomes a retroperitoneal. So it's divided into 4 parts. So let us start off with the first part, also known as D1. It's 5 centimeter long. Just talking about the relationship of the first part. Anterior to the first part, you would have gallbladder and liver. Posteriorly, you will have the common bile duct, gastroduodenal artery, and the inferior vena cava and portal veins. Okay. Second part, also known as D2, is 7.5 centimeter long. It's a structure that curves around the head of pancreas. Anterior to the D2, you have got your transverse colon. Posteriorly, you have got right kidney and ureter. Important anatomically is that your major duodenal papilla, which is also known as the ampulla of water, your minor duodenal papilla, both of which open in the second part of duodenum, and your sphincter of Oddi is present here. Okay, so the major duodenal papilla, which is also known as the ampulla of water, gives rise, or it's the opening of your major pancreatic duct, which is known as the duct of Versang, as well as your common bile duct. The minor duodenal papilla, there's opening of your accessory pancreatic duct, which is your duct of Santorini. Okay. Following that is your third part, which is 10 centimeter long. It runs transversely towards the left. Anterior to it, you have got your superior mesenteric vessels. Posterior to it, you have got your aorta, IVC, and L3. The fourth part is 2.5 centimeter long. Next, we come into the duodenojejunal junction. It is identified by the ligament of Treitz and your inferior mesenteric vessels. Okay, these two structures will identify the duodenojejunal junction. So we know when duodenum ends and when jejunum starts. So the ligament of Treitz is also known as the suspensory ligament. It's basically suspensory ligament of duodenum. It's basically a peritoneal fold from the right crus of diaphragm. It contains some skeletal and smooth muscle fibers. The inferior mesenteric vessels, on the other hand, they descend from behind the pancreas immediately to the left of the junction. Talking about the arterial supply, so everything means a part of duodenum till the opening of the bile duct into D2 is supplied by the superior pancreato-duodenal artery, and the part of duodenum after the opening of bile duct into D2 is supplied by the inferior pancreato-duodenal artery, which is a branch of your superior mesenteric artery. Venous drainage is basically your duodenal veins that drains into the splenic veins, your superior mesenteric veins, and your portal veins. Talking about lymphatic drainage, so lymph vessels from the duodenum drains into the pancreatico-duodenal nodes. That drains into the hepatic nodes, which then drains into the celiac nodes and partly to the superior mesenteric node. And they all end up in the intestinal lymph trunk and finally returns to the cisterna chyli. Nerve supply sympathetic is by the T9 to T10 region, parasympathetic by vagus. So what's the clinical importance of understanding duodenal anatomy? So duodenal ulcer or your peptic ulcer is also known as, which is the erosion of mucosa in duodenum, normally is at D1, where the most common cause is Helicobacter pylori infection or NSAID therapy. So what's the clinical feature? Pain, which is at the right half of epigastrium. Normally the pain is on empty stomach and relieved by meals. So what are the complications that can arise from this is the perforation through the bowel wall, which is a surgical emergency warranting immediate repair. So the perforation can then lead to erosion of your gastroduodenal artery, which can lead to hemorrhage and potential hypovolemic shock. The perforation also can cause inflammation of peritoneum, that is your peritonitis, and damage to surrounding viscera, especially the gallbladder and liver. So other than duodenal ulcers, your duodenum is also commonly affected by duodenal carcinoma. Another pathology that you see at the duodenum commonly are congenital obstruction and stenosis. Commonly is of the D2 at the site of the opening of your bile duct. Okay.